So let's begin the discussion of digoxin. Digoxin is a drug used in congestive heart failure. Digoxin is primarily glycosidic drugs having cardiac inotropic property. Inotropic refers to change in myocardial contractility. So digoxin increase myocardial contractility and cardiac output. Cardiac glycosides are found in several plants and in toad skin. Digitalis lanata is the source of digoxin, the only glycoside that is currently in use. Digoxin has a positive inotropic effect. It means increase in force of contraction. A negative chronotropic effect, that means decrease in heart rate, and a negative dromotropic effect, that means decrease in conduction velocity. So what are cardiac glycosides are made of? Cardiac glycosides are made of desoxygenin, which are attached to one or more sugars. Desoxygenin are made of steroid nucleus and lactone ring. These desoxygenin are attached to one or more sugars. The desoxygenin sometimes refers to a glycone. Now let's talk about mechanism action of digoxin. Digoxin inhibits sodium-potassium pump. Normally sodium-potassium pump throws 3 sodium out, 2 potassium in. So when digoxin inhibits sodium-potassium pump, less sodium can goes out. So intracellularly sodium increases. Due to less concentration gradient of sodium across the membrane, less calcium can goes out. This leads to more accumulation of calcium in the cytosol. So extra calcium enters sarcoplasmic reticulum. More stores of calcium in the sarcoplasmic reticulum. This overpopulation of sodium and calcium within the membrane stimulates L-type calcium channel. L-type calcium channel open in response to change in membrane potential. So when membrane potential reaches threshold potential, these voltage gated calcium channels open. So calcium enters through it during normal depolarization. More release of calcium due to stimulation of ryanodine receptor during depolarization. This overall contributes to strong muscle contraction. This is the summary of mechanism action of digoxin. Digoxin binds to sodium potassium ATPase, inhibits this enzyme. Inhibition leads to accumulation of sodium intracellularly, results in intracellular calcium accumulation. Then there is entry of calcium into cardiac cell via L-type calcium channel. This increase in calcium uptake and stored in sarcoplasmic reticulum. This trigger release of large amount of calcium stored in sarcoplasmic reticulum through ryanodine receptor calcium channel. So cytosolic calcium increases transiently to about 500 nanometer, triggering contraction. This leads to increase in cardiac output. Now let's talk about pharmacological actions of digoxin. Cardiac effects. It includes mechanical effects and electrical effects. In mechanical effects, there is increased contractility of cardiac sarcomere. Due to more forceful contraction of ventricles, there is decrease in diastolic volume, which increases ejection fraction and improve in circulation. There is decrease in sympathetic activity, which decrease peripheral vascular resistance and decrease heart rate. This results in decrease in myocardial oxygen demand. Electrical effects of digitalis on electrical properties of heart are a mixture of direct and autonomic actions. Direct actions of digoxin. It decreases action potential duration, is probably the result of increased potassium concentration which increase potassium conductance that is caused by increased intracellular calcium. Also, inhibition of sodium potassium pump. As toxicity progresses, this leads to overloading of intracellular calcium stores. Due to overloading of intracellular calcium stores, there is appearance of after potential, that is delayed after depolarization. Once DAD, delayed after depolarization, reaches threshold, they exhibit premature beat or ectopic beat, later bigeminy in ECG. Bigeminy is a type of cardiac arrhythmia characterized by a pattern in which every other heartbeat occurs prematurely. Further intoxication leads to tachycardia. So why there is decrease in action potential duration? So when there is increased potassium, there is increase in conductance. Hence hyperkalemia decreases action potential duration. What is delayed after depolarization? Delayed after depolarization are abnormal electrical impulses that can occur during the repolarization phase of the cardiac cycle. This is the normal action potential curve. This is the abnormal action potential curve in which there is appearance of after depolarization or delayed after depolarization, which leads to extra beat or contraction of heart, that is premature beat or ectopic beat. Autonomic actions of digoxin. Autonomic actions of cardiac glycosides on the heart involve both the parasympathetic and sympathetic systems. At low therapeutic dose, parasympathetic effects predominate. Early effect of digoxin or at low doses, effects are due to parasympathetic systems. As cholinergic innervation is much richer in the atria, these actions affect atrial and AV nodal function more than Purkinje or ventricular functions. This leads to atrial arrhythmias and also slow conduction velocity in AV node. At toxic levels, sympathetic outflow is increased by digitalis, thus increases heart rate. Actions of digoxin on blood vessels. Digoxin has weak direct vasoconstrictor action. On kidney, digoxin causes diuresis in congestive heart failure patients, secondary to improvement in circulation and renal perfusion. On CNS, digoxin has little apparent CNS effect in therapeutic dose. Higher doses causes chemoreceptor trigger zone activation, inducing nausea and vomiting. Other effects on heart. Slow conduction velocity in AV node. It is due to inhibition of sodium potassium pump, leads to increase in intracellular sodium and calcium levels in amyloidal cells. It also prolongs the AV nodal refractory period. Pharmacokinetics of digoxin. It is only inotropic drug that can be given orally. It is absorbed mostly by oral route, that is 60 to 80%. Its plasma protein binding is 25%. Its onset of action is about 15 to 30 minutes. Maximum effect may be reached in about 2 to 5 hours. Duration of action lasts for 2 to 6 days. Plasma half-life is about 40 hours. Therapeutic concentration is 0.5 to 1.4 nanogram per milliliter. Toxic concentration is greater than 2 nanogram per milliliter. Daily maintenance dose is about 0.125 to 0.5 milligram. Daily elimination is 35%. It is eliminated mostly by renal. Route of administration is oral or IV route. Uses of digoxin. Two main indications of digoxin are heart failure and control of ventricular rate. in atrial fibrillation or flutter. Also used in PSVT if associated with heart failure. Why digoxin used in atrial fibrillation or atrial flutter? Digoxin can be used for controlling ventricular rate in both the cases. Reduces ventricular rate by decreasing the number of impulses that are able to pass down the AV node and bundle of His. It increases effective refractory period. It increases effective refractory period of AV node by direct action, vagomimetic action, and anti-adrenergic actions. It simply means it increases effective refractory period of AV node by direct actions or parasympathetic actions or by decreasing sympathetic actions. Why digoxin used in congestive cardiac failure? Digoxin is useful in patients with low output failure. It is useful in congestive cardiac failure because of positive inotropic effect, action on venous system, action on kidney. Adverse effect of digoxin. Extracardiac side effects are anorexia, nausea, vomiting, and abdominal pain are usually reported first. It is due to gastric irritation, mesenteric vasoconstriction, and chemoreceptor trigger zone stimulation. Cardiac side effects are pulsus minus is common. Others are nodal and ventricular extrasystoles, ventricular tachycardia, and terminally ventricular fibrillation. Also gynecomastia and xanthopsia allovisions are common. The term pulsus minus refers to pulsus means pulse and minus means in pairs or every other. So in pulsus minus, the heartbeat occurs in pattern where every normal heartbeat is followed by a premature contraction or premature beat. What is ventricular extrasystoles? Ventricular extrasystoles mean premature ventricular contraction. Is a type of abnormal heart rhythm where an extra heartbeat originates in the ventricles before the regular heartbeat is expected. Complications of digoxin. Ventricular tachycardia. Digoxin is or digitalis is contraindicated because it may precipitate ventricular fibrillation. Digoxin primarily affects the electrical conduction system of atria rather than the ventricles. Therefore, its effectiveness in terminating or controlling ventricular tachycardia is limited. Partial AV block. It may be converted to complete AV block by digoxin. Elderly, renal or severe hepatic disease. Patients are more susceptible to digoxin toxicity. In individuals with hepatic disease, the liver's ability to metabolize drugs may be impaired. This may lead to higher level of digoxin in the bloodstream, which increases the risk of toxicity. Thyrotoxicosis. Patients are more prone to develop digitalis arrhythmias, while digoxin elimination is slowed in hypothyroid patients. Thyroid hormones have direct effects on the heart, including increasing heart rate and contractility. And digoxin also affects the heart rate and contractility. When used together in individuals with thyrotoxicosis, there is an increased risk of cardiac effects, which potentially leads to arrhythmias or worsen the cardiac functions. Drug interaction of digoxin with diuretics. Diuretics can cause hypokalemia, which may potentiate the digoxin toxicity and also increase the risk of digitalis arrhythmias. Hypokalemia increases the binding of digoxin to sodium-potassium ATPase. With calcium, calcium increases the incidence of digoxin toxicity. Quinidine, quinidine reduces the binding of digoxin to tissue proteins as well as its renal and biliary clearance by inhibiting efflux transporter P-glycoprotein, due to which plasma concentration of digoxin is doubled, and so digoxin toxicity can occur. With cholestyramine or cholestypol, it binds with the digoxin in gut and reduces its absorption. Digoxin absorption may be reduced by metoclopramide, sucralfate, antacids, neomycin, sulfasalazine. Propranolol, verapamil, diltiazem may additionally depress AV node conduction and oppose positive inotropic action. The changes in ECG due to digoxin include inversion of T-wave, increased PR interval, shortening of QT interval, depression of ST segment. The inversion of T-wave might be due to delayed after depolarization. Digoxin can promote delayed after depolarization, which are abnormal electrical impulses that can occur during the repolarization phase of the cardiac cycle. These after depolarizations can manifest as T-wave inversion. The increase in PR interval, it might be due to after depolarization, which causes extrasystoles and tachycardia, and also due to shortening of action potential duration. The decrease in QT interval is due to slow heart rate, increase AV node refractory period, and slow conduction velocity through AV node. The depression of ST segment might be due to altered intracellular ion concentration, altered myocardial oxygen demand, and also due to conduction abnormalities. This ST segment depression gives rise to Horny ST configuration.